Greetings and welcome to our poster, the COVID-19 and Climate Change Syndemic, Recognizing Global Threats and Opportunities. We represent the University of Illinois and the American University of Antigua. I'm Holly Rosencranz. Our poster is based on a workshop that we deployed to a group of medical students in July of 2020. The issue is that climate change is negatively impacting individuals' physical and mental health. As medical educators, we have recognized that medical trainees are generally not trained to consider its impacts on patient encounters. Now in 2020, compounding this, the COVID-19 pandemic presents personal and planetary health challenges with many common risks and vulnerabilities to climate change. This is a syndemic. A syndemic occurs when two or more concurrent epidemic level diseases with shared drivers cluster to a population. The social and biological interactions worsen the prognosis and impact of each disease and should be addressed when considering patient care and population health. Our goal is to create a virtual workshop for medical students to consider these public health impacts of the shared drivers of climate change and COVID-19, as well as strategies for mitigation and adaptation. The objectives were to review basic climate science, understand human health impacts, recognize pathology, transmission, and clinical presentation of COVID-19, and especially to identify these common vulnerabilities for climate change and COVID-19 that will inspire actions to mitigate the impact of both climate change and COVID-19. I now turn it over to my colleague, Dr. Japhia Ramkumar.
Hello, I'm Japhia Ramkumar. And in the age of the COVID-19 pandemic, this workshop was done virtually. For the didactic part of the session, the facilitators first covered the basic climate science and the connection to human health impacts. They covered the basic science and clinical presentation of COVID-19. And for the syndemic, the shared drivers and vulnerabilities of both, as well as, more importantly, the solutions that address both. The students were then placed in breakout rooms, which were identified by a specific climate change threat. These were heat, air pollution, extreme weather, and environmental degradation. Students then worked in their groups to conceptualize a patient who was vulnerable to both the threat of climate change and COVID-19. They identified possible impacts of their specific climate disaster at the individual and the community level. They created a response plan that factored in COVID-19 and designed a forward-looking mitigation plan that addressed pandemic preparedness and environmental stewardship. The students then presented their hypothetical patient and discussed individual level therapies for their patient, as well as community level mitigation and adaptation strategies. I turn it over to my colleague, Leslie Herzog.
Thank you. Hello, I'm Leslie Herzog. One of the primary training outcomes we wanted to assess was whether our training had significantly impacted students' attitudes regarding the impacts of climate change within the context of the COVID-19 pandemic. Therefore, upon completion of the training, we administered an online survey to the 19 students. The survey consisted of two sets of identical questions. The first three questions assessed students' attitudes prior to the training. The second set of questions assess students' attitudes at the completion of training. You can view the specific questions on the slide. Next slide, please. We compared the pre- and post-training scores for each question using paired sample t-tests. Overall, the results indicated that the training significantly increased the students' awareness of the impact of climate change and COVID-19 on patient health risks. There was also a significant increase in agreement that policy changes that address both COVID-19 and climate change should be prioritized. And now back to my colleague.
So, having raised awareness, knowledge, and imparted some skills in thinking about how to mitigate the impact of both climate change and COVID-19, we would like to move to the next step of training our providers to be effective educators and advocates for the health of their patients, their community, and the planet in the context of the very serious threats of climate change and COVID-19. Thank you for your time and attention, and we welcome any questions.